assistant video.
Good afternoon, ladies and gentlemen. My name is Russell Beatty, and this is my co-founder and partner in the US, Andrew Bonner. We are Instant Access Medical. I'm not going to talk to you today about blockchain or technology. Take that as a given. What we're going to answer for you is the question, why invest in iAM as a company? And I'll introduce this by way of a corporate video to start with.
Internet of Things. We experience instant, borderless access to information. Everything is managed online. So why can't you access your medical record and manage your health online? The healthcare industry has spent a fortune centralizing patient data, but billions are lost in healthcare insurance fraud, medication non-adherence, and treating the consequences of long-term conditions. Prescription abuse is increasing. Cyber criminals target medical data, and it's really difficult to see the best healthcare professionals and share your data with them. Instant Access Medical is changing all that by creating a single, lifelong healthcare record under your control. It collects and integrates your medical data from wherever it is, your family doctor, clinic, or hospital, the wearables or remote devices you use. iAM Smart shares data and maps this against personalized care pathways that trigger specific actions and timely reminders on your mobile device. It helps you navigate healthcare like a GPS so you can manage your health, video stream doctor consultations, and request prescriptions, saving time and money. For over 25 years, 6 million patients, 3,000 physicians, and 18 medical specialties have used our technology to manage and share comprehensive medical records. Now, iAM secures the storage and exchange of records via blockchain. With blockchain integration, iAM will ensure record security with decentralized storage and world-leading encryption, create a tokenized healthcare economy, reduce waste, and speed up transactions. Create trusted, digital, and portable health records that streamline insurance claim settlements and minimize manual errors. Easy, portable management of health data in a comprehensive, up-to-date record under your control. And the ability to share with healthcare professionals to get the best possible outcomes. Developed for mobile, secured by blockchain. Wherever you are, iAM. To get one record for life, visit instantaccessmedical.io.
Thank you very much. Instant Access Medical, we've developed this product as a healthcare GPS, developed for mobile, secured by blockchain, effectively a person-controlled electronic healthcare record. And together with our enterprise partner GuardTime, we launched the world's first blockchain-secured personal care record platform in June of 2018 in the UK. Why will Instant Access Medical succeed? First of all, we have a team with real-world experience, a group of physicians, surgeons, IT specialists and business people, all of us with over 25 years experience in any one case in the industry. We have a proven track record. Financially, we have a fiat system, clinic information system that's been used by 3,000 medical clinics around the world in 5 countries in 4 languages to share and manage the healthcare records of more than 6 million patients. In addition, we've had a partnership with Special Olympics since 2003, where, according to what Andrew was saying earlier, doing well by doing good, we have provided philanthropic support to their organisation for that period of time. And we've taken that expertise that we've developed in this experience over the last 25 years to the blockchain, to this personally controlled electronic health record platform in the iAM marketplace. I'm not going to spend much time on the problem. We all know what the problems are in healthcare. It's well documented in our white paper. It's accessible to you on the website. But effectively, what our solution is a portable healthcare record secured by the blockchain, and this enables us to create what we believe is a $5 billion US healthcare tokenized economy with our business plan. How it works, very, very simply, we aggregate data from clinical information system providers, hospitals, family physicians and other systems in the countries where we operate. We populate the healthcare record of the consumer and it's accessible to them on any device secured by the blockchain. Why will instant access medical succeed? We believe that we solve one of the biggest, if not the biggest, problem in healthcare globally. You're all aware of the fact that healthcare as an industry is an $8.7 trillion industry, and close to 70 to 75% of that spend in developed countries is spent treating the unintended consequences of long-term conditions. And if we take diabetes as an example, treating diabetes itself is relatively inexpensive, and it's not that difficult. But it's when you have to treat the long-term consequences of diabetes that it gets prohibitively expensive. So what Instant Access Medical does is we provide a system whereby the patient on the particular system, we have embedded clinical care pathways, artificial intelligence, using algorithm-driven technologies to place the patient. The system auto-analyzes the parameters of the healthcare data for that patient, places them on the appropriate care pathway, and the system then uses that as a GPS to navigate their healthcare journey. And by doing this, effectively, patients are unfailingly alerted, reminded and recalled in accordance with their treatment program and protocol, the result of which is that their journey and their destination, their healthcare outcome is assured, and it requires very little effort on the part of the physician and no effort on the part of the practice staff or the patient themselves. Why will we succeed commercially? And I think this is critical for investors. We've partnered in our path to market. You can't do everything as a small organisation yourselves when you're raising funds, as we've heard. You have to partner with organisations that have traction in their particular markets. So we've partnered with GuardTime, and GuardTime is the world's leading blockchain development company. They have developed the entire e-government substrate for Estonia, 3,000 plus citizen services. They're a US defence, US intelligence, US governmental agency contractor in America, and we've partnered with them also in terms of reach to the health insurance market. Together with blockchain, the solution that we're developing will be used to quote, where hospitals will quote for the health insurance business in the US using the GuardTime solution, white label from Instant Access Medical. Secondly, in the UK, we spent 8 years developing application interfaces. We're on the desktop of most GPs in the United Kingdom, and we have the ability, not tomorrow, not next year, but today, to populate the healthcare records of up to 30 million patients in the United Kingdom. And we've worked very closely with Healthcare Gateway and DXS International to enable that capability, and the challenge right now is monetizing that and commercial contracts, taking that to the next stage. We also have relationships with Patient Advocate in the UK, with Moxtra, from the founders of WebEx. You'll know WebEx from some years back. Moxtra is our intelligent embedded communications component. And we also have relationships with Validic. Validic has a 400 in-home medical and wearables platform, and that's integrated or will be integrated with Instant Access Medical in the next component. Our business model is a token utility, and we have taken effectively all of the basic business transactions and business processes that occur in healthcare and created a token that is utilised for those particular processes. So effectively, those processes are that we secure, we store, we share, we write, we pay, and we enable consumers to use their healthcare data also to earn. And at a later stage, they will interface to retail point systems too. So what are we doing? We're building what we believe is a $5 billion US tokenized healthcare economy. And we enable doctors, pharmacists, hospitals, public health agencies, researchers and others to use our tokens to pay for services. So in each jurisdiction where this operates, prices will be pegged in fiat, but under the hood paid in iAM tokens.
1 minute.
We have a token sale, like most ICOs. It is a utility token We're in pre-sale at this point in time. Our market cap, our hard cap is 35 million. In our pre-sale, which runs to the end of December of this year, we have an 88% discount on our tokens against the launch price of 40 US cents, which represents, at a bonus level, an 8 times return on that launch price. This will be followed by our main sale on the 15th of January through 15th of March, and the discount when we go to the main sale reduces from 88% to 60% and so on down through the 4 components of the main sale to 0. So we'd like to invite anybody who'd like to know more about that to visit with us during the speed dating. We'll tell you more about our plans for the ICO and the utility token sale. We have a lady.
If you could grant us 2 more minutes. So one of our advisors is the former head of healthcare and aging, and she just gave a testimonial to the product.
As a policymaker and consumer advocate, I've spent years working with governments, insurers, healthcare systems, and clinicians on ways to ensure healthy outcomes for patients. One thing every one of us learned is that all the medical advances in the world won't take hold unless the consumer, the patient, is fully engaged, informed, and motivated to take control of their own health. When they aren't, we see the fallout every day in emergency departments, filled with patients who didn't comply with taking their medications, didn't follow their doctor's directions on controlling their diabetes, or were simply overwhelmed managing and juggling multiple chronic conditions with a myriad of specialists. The list goes on, costing hundreds of millions of dollars to an overburdened and costly healthcare system. On the flip side, we now live in exciting times with artificial intelligence, machine learning, big data giving us the benefit of predictive analytics, the use of wearable devices that monitor and track health in real time, along with telehealth that allows us instant access to specialists on our smartphone. Platforms such as the one pioneered and offered by Instant Access Medical unify state-of-the-art technology that allows patients to truly own and access their own personal health records, allows them to share their data with multiple clinicians and sync it up with wearable devices and track and monitor their health. Consumers can see how they're progressing, they can receive alerts to get them back on track, organize their appointments, and are given educational tips along their care pathway. By using blockchain, the iAM platform provides end-to-end security of records in transit. As a result, not only do patients become more engaged and knowledgeable, insurers and clinicians learn through analyzing population health data how to better manage patient care and assess health outcomes. They learn what's working and change what's not. This means that through the iAM MyPHR platform, health plans and clinicians can better facilitate patient compliance, which in turn should reduce unnecessary utilization of tests, preventable visits to emergency departments, and a reduction in hospital readmission rates, all of which yields better health outcomes for every stakeholder along the healthcare pathway, and giving consumers the tools to protect their most valuable asset, their health.
All right, well, let's go quickly. Judges, just a couple quick questions. We've got to move on.
Maybe I should start. So this is definitely a very interesting space that I have no doubts there's a use case for blockchain. The challenge that I have is that just in the past quarter, I've probably seen at least 20 companies doing exactly the same thing as you guys are doing in different countries, in different states. How do you differentiate yourself, and how do you give somebody confidence as an investor that you are the ones who are going to win?
Thanks very much for the question. I think it's a critically important question for investors like yourselves. What we see with many of the competitors is that people have taken a very simple process like an emergency discharge plan, and they've computerized it, and they've talked it up into a world-beating electronic health record that's going to do all things to all people. It's not. What people don't have out there is the commercial nous to have built the commercial partnerships that can enable the delivery of these healthcare systems. It's not just building it, they will come. We know from experience over 25 years that doesn't happen. I have owned and operated a healthcare business with over 1,000 clients using medical practice systems in Australia. We've done the same thing with Special Olympics. We've done this with 6 million patients around the country over the globe over the last 25 years. We know that doesn't work. It takes years and years and years to get application integration working, years and years and years to get people to talk to you from those hospital systems, from Cerner, from Epic, from 4Care, of these people. You don't just build the system, do an ICO, track some money, and succeed. Most cases like that are the 90% that fail.
Yeah, just about the application side of the customer interface side is what you may be seeing a lot of. But in terms of the algorithms, the care pathways, the history that we've put into the development, that I've never seen anyone that does what we've done. Now, I'd be happy to discuss if there's companies that you reference, you've obviously seen them. But from our standpoint, what we've done with over 1 million healthcare records of people with intellectual disabilities in 100 countries in all 50 states has yet to be presented as done anywhere I've seen. So,
When you say done, what do you mean by that?
functional, deliverable, in use, in practice,
On your blockchain?
on anywhere.
No, but today, do you have those records on your blockchain today?
The answer to that is
Yeah.
no. The answer to that is no.
We
We are retrofitting using Godtime's blockchain our Fiat clinical information system. We're using a Health One architecture that's been around. It is a blockchain. It is a blockchain solution that we have for many years. It's being hashed and it's being retrofitted. So the answer to your first question is no. But in terms of the ability to get that out there is yes, very quickly.
And do you use public or private chain?
It's private. It's a private blockchain. We don't believe in scale. I'm not a technologist, and there are people here who can better answer the question. We've already heard about ECR20 tokens and the limitations with Ethereum. So we are not using distributed ledger in the pure sense of the word, because this will not scale across all those nodes where those ledgers need to be. It's a private blockchain, and we're using the blockchain primarily to secure the records and the transfer of the records.
So I think we should move on, and I think follow up. And just a reminder, we're all going to be upstairs afterwards, speed dating, cocktails on the Crown Room. Thank you very much, gentlemen.